If you find you're losing your sense of smell, you could be at risk for Parkinson's disease. The Michael J. Fox Foundation is sponsoring a clinical trial to study that connection, and they need your help. Well, joining me now is Dr. Dana Jennings. She's from the Institute for Neurodegenerative Disorders in New Haven, Connecticut. Good to see you.
Oh, nice to see you too.
All right, so let's talk about this whole connection. What is it between the sense of smell and Parkinson's? What's the link?
So it turns out that almost everybody with Parkinson's disease has a decrease in their sense of smell. And anecdotally, if you ask people about that relationship, they say, well, in fact, I lost my sense of smell many years before I developed Parkinson's disease.
But don't a lot of old people lose their sense of smell? Isn't that something that happens as you get older?
The sense of smell does decrease with age. However, in Parkinson's, it's more than just decrease. It's in fact just lost. I mean, it's tragically lost.
Wow, okay. So you test people with their sense of smell, and I have this little smell identification test, little booklet, which is kind of cool. How does this work?
So this is a 40-item scratch and sniff smell test. So, and it's a multiple choice. You can answer, A through D. And we are administering this to not people with Parkinson's disease, but actually individuals that are over the age of 60 as a potential, screening tool for Parkinson's disease. So really what we're trying to do is identify people that we think might be at risk for Parkinson's.
All right. So if I have something like this, I would basically take this and it says I would scratch this with this pencil. So I'm going to scratch it and then smell it.
Correct.
And it says, this odor smells like, and it gives me choices like chocolate, banana, onion, and fruit punch. I think it smells like onion.
For this study, we're actually looking for anybody over the age of 70, or I'm sorry, over the age of 60, and that can't have a diagnosis of Parkinson's or Alzheimer's disease. So, that really opens it up to, the general population. The first step really is to go online and take a smell survey, and it's just a demographic information, asking you questions about whether you have Parkinson's, Alzheimer's, et cetera, and making sure that you're eligible to actually receive the smell test in the mail. So it's an observational study. There's a number of people, 400 people with Parkinson's, about 200 healthy controls that are already involved in the study, but now we're actually recruiting people that may be at risk for Parkinson's.
Okay, so there are treatments for Parkinson's where you can kind of like help with some of the symptoms. What do you think is the most exciting thing in the future for Parkinson's?
So one of the really critical pieces is to try to develop medications to stop, slow, or even prevent the onset of Parkinson's. So in looking at people that may be at risk for Parkinson's, I think we actually have an opportunity to actually delay the onset and possibly even prevent the onset.
Yeah, that would be fantastic.
Yes.
All right, Dr. Dana Jennings, thanks so much for coming. So good to see you. Some great information.